Okay, the next presentation is on the future of echocardiography. This talk was selected by the organization. It's probably interesting to discuss and to see what the future will bring for echocardiography. Now, what I will cover is the digital techniques and the miniaturization, the transducer technology and the imaging performance. I have already indicated some developments for real-time three-dimensional echocardiography and the amazing progress in transducer technology. Then the digital techniques will further lead to downsizing and upgrading the performance of our systems. And then a few words on the appropriateness of imaging methods. Now, it was Einstein who said that any intelligent fool can make things bigger, but it takes a touch of genius and a lot of courage to move in the opposite direction. Now, we have seen for all medical equipment that there is over time miniaturization. This is the electrocardiograph as it was commercially introduced in 1906, and this is the 12-lead electrocardiograph as we have it today, and the size can be made as small that you virtually bring it down to a chip. The size of these electrocardiographs these days is determined by the connectors. You cannot make the connectors smaller to the patient, but otherwise they are really, really small. And that's thanks to the development of the processors, and the speed of the processors and the memory capacities has gone up, and people is now already working on 3 trillion computations per second processors. So it's increasing and increasing, and we will see new materials. Instead of selenium, we are using germanium, and there is no end to this. And the Moore's law is still followed in the progress of the technology. What we have seen is the development of catheter tip transducers. They function at 10 frequency of up to 10 megahertz. They are 10 French, and they can be used for interventions, or the electrophysiologists, for instance, use them daily in the intervention laboratory. Here you see the catheter pushing the interatrial septum to pass it into the left ventricular cavity. We have seen the downsizing of the multiplane probes. This is one of the first rotational probes. Went further down to a smaller size. This is about 6 millimeters. And now we have these micro multiplane TE probes that we can use in newborns and in babies. This is an example of a baby, 2.3 kilogram newborn, where we have a transesophageal imaging of the aorta and a coronary artery. The baby had a transposition of the great arteries. In these babies, we don't use any other imaging in our institution. Surgeons, and with the help of some of the pediatric cardiologists, they do everything with echocardiography, and more particularly transesophageal echocardiography. And you see here the decrease of operation or CATs versus operations. They were all in the 80s. There were 20% more CATs than operations, and now it went down. And it's only in those patients where you need information of the great blood vessels that catheterization and angiography is performed. All the rest is on the basis of echocardiography. What we will see in the future is that the left ventricular can be monitored by transducers and probes that are much smaller than the one that you see here, but in certain circumstances it can already be done. Now, this was a major progress in real-time three-dimensional echocardiography, the development of a transducer with these 150 print boards in it. So, very nice example of miniaturization. And the next major progress was the use of monocrystal transducers, where they are all layered in the same direction. These transducers are 100% more effective than the piezo crystal transducers that are used as standard in the most of the currently available systems. This is a standard transducer, and this is like packed sand. And all these transducers have their vectors when you activate them. Well, when they are inactivated in different directions. When they activate them, they are not squeezing out energy all in the same direction. So you get only 40% effectiveness, whereas these transducers go up to 85%. So you can make them smaller to have the same performance, and of course you have much less interaction between crystals and you have much less noise. So these transducers can be made smaller, are more sensitive, and you avoid the noise in your image. Now the multiplane probe is the result of that. These are these monocrystals, so they can be made very small for volumetric acquisition. The other advantage is that they are megaband transducers, so for many applications, harmonic imaging, superharmonic imaging, and in contrast studies, they also offer major advantages. This is an example of a 4-month-old infant, tricuspid atresia, and a muscular ventricular septal defect. And you see in this small heart the detailed pathology of the ventricular septal defect. This is a view from the left straight on the interventricular septum. This is the septum where we look at it perpendicular. Another development are the capacitive microfabricated transducers, the CMUTs. Now these are very small. There are thousands of these little drums on a foil, and what we may see in the future is a transducer which is like a sheet wrapped around the chest wall, and all the transducers are active so that we become more independent from windows. So we use all the available windows on the chest wall to create the image. The resolution of these CMUTs is excellent. Obviously, the power for imaging the heart is at the moment still insufficient, but here you see a cross-section of a tendon, and you see the different fibers here in cross-section, and this is a longitudinal image of the same tendon. So it can already be used for tissue imaging. The digital techniques, the imaging processing analytic software, the possibilities are increasing. You have already seen this. We have almost online left ventricular function, which is a very important parameter and the most common request for an echocardiographic study in our laboratories, so the turnover time and the analytic time is much shortened. The safety for left ventricular function for echo is 100%, whereas there are doubts, of course, for the gadolinium, and even people now that are working in the MR environment are claiming some rheumatic problems, pain problems, just like they do for the towers for the radio transmission and our telephone transmission. So it's not so 100% sure. The gadolinium, of course, is not 100% safe, but the radiation, the magnetic fields is also a question. And obviously, CT uses ionizing energy and the same contrast material. I barely can think of CT being a non-invasive technique, and that's what people say, or try to convince us. Now, the parametric display is an increasing way of visualizing phenomena that we can't see with the eye, and we call that higher dimensional imaging. For instance, the activation of the heart goes so fast that we never can see it with our eyes. But with the computers, we can follow it, and also the motion patterns, which are in some conditions pretty fast, can also be displayed in a diagram like this. This is a left ventral branch block, and the contraction here in this area is very late.